We know quite a bit about structural valve deterioration after SAVR. After TAVR, actually, there's less information available. So in the February 16th issue of JACC, there is a paper on the incidence, timing, and prediction of valve hemodynamic deterioration after TAVR. And I would like to introduce you, welcoming back Dr. Josep Rode s-Cabau, who is an MD at Quebec Heart Lung Institute in Laval University up in Canada. So first off, why did you decide to do this particular paper?
We decided to do this paper because I think that one of the important aspects and issues in all this field is really to try to understand whether or not there is some valve deterioration. We are talking more and more about valve durability, and we are talking more and more about the potential issue of valve thrombosis, even if subclinical in some instances. Then we thought that collecting a significant number of patients with serial follow-up echocardiographies was important in order to see whether or not we were able to detect any valve hemodynamic deterioration in this cohort of patients, including balloon expandable or self-expandable valves, and particularly the factors associated with such phenomena.
So how many patients did you look at and what did you find?
We look at around 1,500 patients. All of them had at least one echo at follow-up at 6 months to 1 year follow-up, and a significant proportion of them had echoes at 2 years, 3 years, and up to 4 years. And what we found is that there was a very mild increase in the mean gradient over time of 0.3 millimeters of mercury per year, very, very small. And interestingly, this mild increase was mainly dependent on a cohort of patients that represented about 4.5% of the patients who had a more significant increase in mean gradients over time. We define significant increase as an increase in mean gradient over 10 millimeters of mercury. Is well considered as over the variability of a measurement of mean gradient. And these, as I said, this small increase was mainly dependent on this small cohort of patients.
At the top of the interview, I mentioned the fact that we know a lot more about SAVR and the type of deterioration after that procedure. How does it compare, TAVR versus SAVR?
In fact, we have a good comparison because we have the partner trial, and then we have the Coll US pivotal trial. In the partner trial at 5-year follow-up, it seems to be comparable to the surgical valves, the balloon expandable Edwards valve. With the core valve, we have that now up to 2-year follow-up showing the same results. And in this particular aspect of subclinical increases in mean gradients, there are not a lot of papers in the surgical literature looking specifically at this. And one of the important messages also of this study was that when we look at the factors associated with this mild increase in mean gradients, we found that lack anticoagulation was an important factor. It increased up to 3 times the risk of increasing gradients over time when you did not receive anticoagulation therapy, valve-in-valve procedures, smaller valves, and a higher body mass index. These were the factors we identified, and I think that again, these changes were not associated with clinical endpoints, except for a minority of patients with very severe increase in mean gradients. But I think that our hypothesis generating in terms of what should be the best antithrombotic treatment after TAVR, to look more closely at those patients who are treated with valve-in-valve, smaller valves, etc. I think that it provided some information about these valve hemodynamics over time that was not known to date.
You have to be pretty happy with what you're seeing at this point.
For sure, and I think that, as I said, and is very important, this was more an echocardiographic study, but Some of the patients were, for whom we observed a small increase in these mean gradients, this small increase was maintained over time. Was not a progressive increase in mean gradients. As I said, up to now, at least at 5 years follow-up, we can say that in terms of valve hemodynamics, these valves are comparable at least to the surgical valves.
Well, this paper is in the February 16th, 2016 issue of JACC. Please look for that. I'm Rick McGuire, Executive Editor, Cardio Source World News.